treatments you have to take and how to manage other problems like vaccination, like COVID vaccination, what we should do as a family. Because sometimes the child can't take vaccination, so everybody else should take the vaccination because of that the child is protected. So there are things like this that we are going to talk about. So that will take about 1 hour. Then we are going to do, those children who have come, we want to do the medical examination. And because so far you all the time have to deal with me and I'm busy and I don't answer all the time correctly. So we are going to have a person now whom you can call who will make sure that you get your answer very timely and very good. And even the medicines that you need, he will make sure that everything is done properly. So we're going to Mr. Salama. Little closer. It's on. Mr. Salokkumar. So Mr. Salokkumar will be there now to help you from now onwards, all of you. If you contact him, आपको कोई भी problem है तो you can contact him, and he will make sure that the doctors are contacted and the correct advised or provided. And he will also be in charge of checking. So for those of you who cannot travel, like some people are not able to travel, many are not able to travel, he will be able to go there and check them out at least maybe once or twice, once or in a year or once in 2 years. He will make a visit to everybody and make sure that they are all checked once at least and they have a medical checkup done properly, so that after that we know what their status is before we give advice. So some of these things will help to improve the children, because I think small children are okay, they are able to come in, but older people are not able to come. So for them we want to have that. So those are the few things. And then secondly, today those children or those patients who have come, we are going to do a full medical examination. We will keep records with the FOP India, not with the hospital. But we will keep records with the FOP India. So your records are here. So anything that happens or doesn't happen, we will keep recording in that. So your records will be maintained. So that is the next thing. Okay? And just explain. You can actually keep talking even if I'm talking. So everybody is understanding what is going on. So this is what we're going to do. So first thing that we will talk about is
पिंक शर्ट नाही ते आहे ना तुमचं आहे ना ते चालू शकते मग अगर जे इकडे येऊ नाही शकत ना मग ते तुमच्या घरी येणार आणि तुम्हाला काही पण असेल ना तर तुम्ही त्यांना विचारा ते तुम्हाला बरोबर तर ते तुम्हाला एकदाच ते सगळं आपल्याला टाकणार की कसं होतं त्यांनी काय करायचं कुठचे मेडिसिन घ्यायचं ते सगळं आपल्याला टाकणार
So we are just going to now talk about a very first time I saw an FOP patient. Okay, so this patient is not able to sit up. Do any of you relate with that situation that you found that some joint is not moving? Anybody? Did you find that the very time that you make it understand that you have a problem is when a joint is not moving properly? Anybody here? Did you notice that first? Any joint, hip or knee or here. So how many people have that they found that some joint was not moving properly? So if you say, no, you sit down. Somebody just, did you encounter that? So yes. Did you encounter that? Yes. For him, did you encounter that some joint was not moving properly at any time?
No, we found it only after biopsy.
But you did see that the joint was not moving, so you have a joint not moving. Okay. Anybody there on the table where you found that the joint was not moving properly, as in an early sign that when you find that some joints are not moving, either the neck is not moving or the shoulder is not moving or the knee is not moving. I remember Arnav's first problem was the knee was not moving. Very first. And later. Before that he came very early, 1 year before that. His knee was not moving. So I know. नहीं वो डॉक्टर आपे को देखा था आपने उस टाइम में किसी और डॉक्टर को देखा था शुरू में एक बहुत पुराना है हमारे पास आए हैं उससे 1 साल पुरानी उससे पहले नहीं आया तो इसका घुटना में ओके so some other child I know उसका सिर्फ घुटना नहीं ठीक से मुड़ रहा था तो डॉक्टर ने देखा घुटना नहीं मुड़ रहा है so they told okay do exercise and go. So what should they look at? So I am sure now all of you know. So what should the doctor look at if there is a lack of movement in the joint? क्या देखना चाहिए था डॉक्टर को? यदि कुछ जॉइंट नहीं मूव करता तो कैसे पता चलता है कि कोई प्रॉब्लम हो सकता है? जॉइंट में नहीं कहीं और प्रॉब्लम है.
Yeah, the toes are they bent?
Yeah.
And then the inflammation.
Yes.
Combination of inflammation.
So 2 problems. Toes bending. Do you know what kind of a toe bending it is? Okay. Do you know what kind of a toe bending problem is it?
FOP.
It's a short toe, right? It's a short toe and it is bent outwards. So that is outwards is balance. And so short and bent toe is how everybody can make out combined with stiffness. So 2 problems: stiffness and short toe. That should make you suspect. What else? Everybody relates to that short toe, bent toe with joint stiffness is suspecting FOP. What else may be there? So which joint do you think will be the first one affected? Where do you think the problem has come first? In the neck? In the neck? How many people had neck as the first problem? Yes. So that is the first very common thing. So when we have problem with the neck, so anything else which tells us that there may be a problem, some swellings may be there. Oh, hard swelling in the neck, back, sometime here. I know one of our children had a surgery operation done here and here because they said that the muscle is not right. But actually the muscle is okay. There the problem is same thing happened to him also. That is common. People do even operation here and here to release the neck, thinking the neck is the problem. But neck is not the problem. The problem will actually be in the back of the neck, and if they felt it, they will see. So, bone swelling, stiffness of the joint, starting from the neck, and so we all know. So we have to actually tell the doctors, because the doctors are sometimes they see very rare. 99% of the doctor would never have seen this problem. Because they don't see, because almost all the patients that I've seen had some harmful operation done to them. Because the doctors don't know about this problem. So when you see the doctor, first thing is don't think the doctor knows everything. The doctor will not know. So we must tell doctor that there is a problem, there is this toe problem, there is this bony swellings, and there is limitation of movement. So they have to take precautions. And you must carry that. You have the FOP guidelines with you. So you can download it. You have the link on your in your family group. The links are there. So you can download it. You can download in your language, because it is in 4 languages: in Bengali, Tamil, Telugu. I don't have it in Malayalam and English. I think 4 languages are there. Okay. So download when you go to the on your phone and keep it with you, so that when you go to the doctor you show. So this is what happened for one of our children. He had a fall. He got a hematoma in the brain. So when the brother went to the doctor, he told that this is the problem. This is the things that you should not do, and he immediately gave me a call. So I called the neurosurgeon and we spoke, and they understand what is to be done. So it is important that you protect yourself. You carry these guidelines with you, because the doctor will not know. No doctor in that hospital knew about this condition. Only the patient's brother knew. And the patient's brother was able to help because he knew, and he also had the phone number because of our group. So that he was able to make the doctor call me. He first called me and he made the doctor speak. So we have to protect ourselves. We have to understand that the doctors will not know, because such such a rare condition, they would never have seen one. And if they have not seen one, they will not know to treat properly. So it is for us to look after ourselves. And within the group, you must get the guideline, show the doctor guideline, and remember the guideline also. So those are the important things. So this child actually, when the doctor did the X-ray, he didn't find anything on the X-ray. They would have sent him for exercises, okay? But fortunately, neck X-ray was taken because neck also was taken. So can you see something in the neck here? These are the bones, okay? Is there a pointer somewhere? Do we have a pointer? Is it the pointer? But can you see a line of bones where the arrows are at the back? So normally you have only one set of bones, one bone which goes from here to here. But here, right at the back under the skin, can you see another bone coming there? So that actually should have told the doctor that there is a problem. Okay? And if that doesn't tell the doctor that there is a problem, can you see the toes? So the toes should have told the doctor that there is a problem. But what happens is we wear shoes or chappals and the doctors are not looking at our feet, so they will miss it. So we must be aware that we should tell about the feet. Hands also. Some children have on the hands also. So either the hands or feet. So bent toe is one, and some children have one particular kind of FOP. They will have short, very short, and the last bit of the finger or the toe will be missing. So that is another kind of thing, but that is very rare. Only one or two children now 100 will. So again, they can see it based only also on the X-ray. So in X-ray, it is not hallux valgus is a common condition that happens in other conditions also. But there is a difference between this hallux valgus and other hallux valgus. Normally we have two bones in our big toe, but these children have only one bone in the big toe. So that I think again that is something you have to know. And see that this child already had before coming already had biopsies in the back, and because of the biopsy in the back, the swellings are becoming bigger and bigger. So again, what it emphasizes, we have to look after ourselves. And we have to make sure that we don't allow the doctor to operate. So the operations are allowed only for like rare things like life-saving things like an appendicectomy or abdominal surgery or something which is needed, or like for this boy taking out the blood clot from the brain. Those things are emergency needed. Other kind of surgery for removing lumps or straightening the toes, not required. Small babies will come to the hospital for straightening the toes. So if the doctor doesn't know, the perfectly normal babies, they can be, they will develop very many joint stiffness after that because the doctor operates. So what is FOP? It is carried in the gene, okay? So the gene is there in the child, and usually it is only in the child, it is not in the parents. Okay? So it's very, very rare for a child to have a parent to have a second child who also has FOP. So it is not common. If it happens less than 2% of the time. So in general, we don't have to worry that more than one child will have, because the disease itself is very rare. So there are some families where they have many members of the family having those are very, very rare conditions. That is familial one, where the mother or somebody carries the gene in the germ line. So those families only will have the second and third or other members of the family having So how often do you think this happens? It's like a one in a million or something like that. So in the whole country, we will maybe have, how many patients do you think we have? 1,300 or 1,400? 1,400 approximately? 1,000?
Doctor, now it has increased to 1 in a million? Is that
1 in a million is what.
So now if the population is 140 crore, then you are 1,400.
1,400 in.
Likely to have.
Yeah, we have 1.4 billion now.
Yeah, 1.4 billion, 140 crores.
Yeah.
One per 10 लोग
So
एक करोड़ में.
So our country has now 1,400 children. How many do we know that there are? We know less than 100. Just about 100 children we know have patients.
Some are remaining undiagnosed.
So all the others are being mistreated by the doctors, or told that they are crazy, or told that there is no treatment and they are sent back, told that they have got CP or cerebral palsy or some other disease, and sent, and they are not being treated. So I think that is why, for the sake of all the children who are not diagnosed, all the patients who are suffering, we should make sure that every time we go to a doctor, you immediately make sure that they are aware of it. Because once you see one, I saw one. Because I saw one, I am able to see other 75. Because every time I even hear somebody talking about it, I know I can immediately correlate that there will be most likely FOP. But if I've never seen one, I would never be able to diagnose.
So doctor, your first experience when you saw the first FOP patient, how did you know? Because it is so rare.
Yes.
So you saw Bentu and then inflammation and...
No, I didn't see it like that. We had a small boy who came to Vellore and he had a spicule in the back. Just one strand, fibrous strand, not even more, coming like this from the back. So the doctors had a discussion and they said we will do a biopsy because we do not know what it is. Okay. So I was interested in pediatrics in those days. I was still a general orthopedic surgeon. So I had a book. That book had a chapter on FOP, which I had read. So I knew that the toes will tell us that this child is FOP or not. So because we didn't know the diagnosis, because there was no possible diagnosis for us, and because the toes were abnormal, I said stop, don't do it, because the book says that if the toes are like this, it is FOP. And I don't think at that time any genetic test was available.
Right.
So everybody laughed at me, and I begged. I remember Saturday afternoon taking the book, going from room to room and showing everybody and saying don't do it. And but they went ahead and did the operation. And the child did very badly because after the surgery in the back, he got swellings all over the back. He got very stiff.
Yeah.
But that stuck in my mind forever and ever. After that, I was able to diagnose so many places. Just hearing a conversation, I was able to diagnose. But my husband was saying there is this very rare case. He's a pathologist. He said we have sent the case to Mayo Clinic because nobody knows the diagnosis, because we are not able to make the diagnosis. Because they have a tumor in the neck and they can't diagnose what kind of a tumor in the neck. And so I said, tumor in the neck in a 5-6-year-old boy, I said, have you asked them to look for the toes? Can you ask them to send the child and do a genetic test? So the next day he went and told the surgeon, look, can you send the child for the genetic test? Most likely it is FOP. And the surgeon very grudgingly, by the way, very grudgingly said, let us do the test, and we knew it was FOP and it was FOP. So just by hearing a conversation, we are able to do because we know. If we don't know, we don't know. Then I can't make any connection.
Right. That is
But
the
like
challenge
this-
as parents. If you go to a hospital, my child, she had a contracture here in the arm.
Yeah.
Even before that, I think she had a stiff neck, which we didn't notice. I think she was already walking like that, and one fine day she had this. So there, when you go to a doctor, we don't even know how to tell.
So
them.
the doctor also doesn't know because it's 1 in a million thing.
Right.
And unless he is a person to whom the stiff bones joints come, that's why we try to teach all the rheumatologists and all the orthopedic surgeons because they are the ones who are likely to see. But I think we have to teach all the surgeons because they are the ones who are likely to put the knife.
Correct.
So we
So
should
that
teach all the
chapter on pediatric orthopedic manual that you read, I think it is not a chapter in the general orthopedics.
No, it is not.
That is that probably has to be
I have
popularized.
put a chapter now in general orthopedic.
Okay.
I wrote the chapter.
Okay.
So it's there.
Now it's there.
Now it's
It's very clear.
Now it's there with the picture. So
All over India, doctor.
it is a classical textbook.
Okay. Thank you.
All the stiffness at the joints, it's necessary that they will convert into bones or they will subside sometimes.
And let us do the. I'm coming back.
Okay.
I'm coming back to it because we are going to talk about the stiffness of the joints also. Okay. So one of the things that we have to understand is how this swelling comes. So if you first get it in the neck, it will go from the head end to the bottom. So it is spread from top to bottom. This particular one is very difficult to stop. It slowly comes and it is not actually like you can control it. It is going to come with every inflammatory episode it comes. What we can actually probably prevent little better is more the peripheral joints by avoiding the trauma and various other things. So it goes from head to toe, and it goes from upper limb then and then the lower limb, like in this fashion. Then from center to the periphery. So mainly the big joints first, then these joints. I think one of the things we have to understand is, which we don't realize, are two things which are very important. One is the jaw. So anytime there is any jaw issue, you don't wait at all, because the jaw issue is going to cause, is going to fuse, and that causes for a lot of feeding difficulty, mouth opening and things like that. So we have to be very vigilant and see even steroids when we give prednisone or something. If you give after 2 days or 3 days, if you're wasting time trying to contact me for 3 days and I'm not answering, and by the time I say it out, 5 days or more, that's not a good thing. We should start within 12 hours of developing the problem. We should start the steroids. For that, every one of you should keep the steroids in your pocket or in your purse or wherever it is. It should be there, available. So you can start within 12 hours. So moving joints, that is hip joints, shoulder joints, elbow joints, knee joints, they are very important joints. We can't afford to lose them. And jaw. These joints we can't afford to lose. And these we can prevent to some extent. So I think for them, this treatment is very important. But one thing which we never notice and which slowly comes by the time the child is 50, 60-year-old, it causes a lot of trouble for them, is the breathing. So I think last time we got the spirometers for everybody. Do you have the spirometer with you? Yeah. Are you doing the exercise every day? So one of the things that every child should have, you have the spirometer, that breathing one? Yeah. Is he doing every day? Hindi based? Okay. Alright, so we switch to Hindi. You can understand Hindi and translate in Malayalam also? That's what.
Hindi and English.
Okay, you go there. You go there. I will speak Hindi. Yeah, I'll speak Hindi. You go there and then you can speak in English so that the translation. So one of the things that we have to be very vigilant, which is not seen, which nobody will tell, like when a child will not notice, you will not notice, is the breathing. And that actually gets stiffer and stiffer. But one thing we can do is to keep our lungs capacity very high by doing regular exercises with spirometer. Those deep breathing exercises will make the lungs big at the time when they're small. And then when they become adolescents, the lungs stay big. So that will be very useful for them when they're older, when the pneumonias and all come. Then to have those good big lungs will be very good. So I want everyone to understand how important it is for the breathing exercise. Okay. So if you don't have the spirometers, I'm willing to pay for it and send it to you. Just ask me. But don't not do the spirometer exercises. I think we finished all the ones that we have given away now. But if you want, we are willing to donate it for you.
Spirometer.
Breathing exercise.
Have you all you have spirometer? We have spirometer. Do you have spirometer for your baby? Do we have an extra spirometer? He doesn't. Mr. Sarvakumar will teach you how to use it, okay?
Where do you get it?
You can actually buy it in any pharmacy.
Pharmacy, we'll buy it.
It's a very, not a very expensive thing, but a very life-saving product. Every day you should, because it should become a habit to take it. It's like those old style exercises. This is the
Stiffness
plan.
ಆದಾಗ movement control.
Okay. So I think this is the thing that I want to emphasize on this.
Breathing problem. So breathing exercise.
So when do this?
Functional capacity. Functions. Stop
So anybody not doing their exercises, you raise their hand. You give you extra coaching. Doing exercise every day. We should give you some extra coaching.
backside.
Very necessary. You must. We don't do it form in whole body. Big lungs and lungs for that. So how do these swellings come and how this distinction? Can you tell me one cause each? How the swelling will come? This table tell me two causes. Two patients. What will cause the swellings to come? What will cause the stiffness to come? Can you give me some idea?
Control model. Complete and stop model. Control model.
Okay, very good. So she says trauma. If the baby falls on the floor, they will get swelling on the head. On the head. So very good. That is common even before they get the neck. Many of them will have a swelling on the head, which they just think it's a bump because they're neck. Yeah. So we don't realize that it is not often that everybody gets a bump, but he got the bump. Yeah. So that should be the first sign for you to take. Yes. Anything else other than that?
Swelling height and
Then ask him when he notices that the baby boy has.
Doctor, I have a question. My daughter she sings a lot. So she's asking, is this spirometer in addition to the singing?
Yes.
So in addition to that also spirometer.
Singing is very good actually. Singing is a very good exercise for the lungs. So don't stop for singing.
Every day as 2 times is possible. Twice.
Same thing happened. She got the
His son gets often he asks आपका बच्चा का बहुत बार प्रॉब्लम आता है ना, क्या करने से प्रॉब्लम आता है, समझाओगे मुझे? नहीं, क्या करने से शुरू हो जाता है? बार-बार आप फोन करता है, witnessing. So again, fall. So fall can be more dangerous when you're stiff, right? So what can you do? Fall can be dangerous when you're stiff because if your neck is stiff, it can break. If your bones are stiff, they can break more easily because like when we are falling down, the joint will bend and then that will take some of the force. Okay? So the fall will not do as much harm if our joints are bending. They will do more harm because supposing if I fall like this and I put out my hand, I will not hit my head. But if I don't have my hands because my hand is like this, I'll fall all the way and hit my ground will go, my head will go hit the ground, or this arm will hit the ground here. So the fall is much more dangerous when we are stiff. So the fall is not good. So one of the things which I realized I never told our patients is we tell our patients, especially if their arms are not able to spread out and prevent them from fall, we should make sure that when they are in a little, maybe not within the house where there are walls and things like that to support them, we should ask them that they be protected with a helmet. Because this is, I mean, Pranav getting this hematoma, it was very worrying and I was feeling very bad how he got this bad subdural hematoma. So I think when upper limbs are not moving well, जब हाथ ऊपर से नहीं move करता है अच्छा, तो हेलमेट पहनना अच्छा रहेगा. लाइट वेट एक हेलमेट बनाना है क्योंकि हाई स्पीड पे तो नहीं जा रहे हैं, ऑर्डिनरी स्पीड पे ही जा रहे हैं. तो फिर भी हेलमेट से सिर बचाया जा सकता है. ठीक है.
कुशन करेगा, शीट करेगा, प्रोटेक्शन.
और कैसे चोट लग सकता है? आपका किसी का डेंटल प्रोसीजर हुआ है? किसी भी बच्चे का? किसी का दांत का किसी का कोई कुछ किया है? दांत में आपका दांत का कुछ हुआ था ना बेटा पिछला बारी? आपने दांत का करवाया था ना? You did something for your teeth last time, no? Last checkup you went, no? But there was nothing to be done in the teeth. Supposing the doctor has to do your tooth, can he harm you? Can the doctor give you harm because they do something for you? They can, because they can open your mouth for very long time. If they open it for very long time, the muscle there will get damaged, and that will form a ossification, and then you'll not be able to open your mouth. So, if you're going for dental operation, what do you have to tell the doctor? Take the guidelines,